COVID-19 cases drop. The number of new COVID-19 cases drops below the 400 mark in the last 3 consecutive days. Kenya recorded 397 new COVID-19 cases today, even as the deaths shoot up to 12 people. No liquor in Kiambu. Alcohol lovers in Kiambu have until this weekend to enjoy their bottle in the company of their friends. Kiambu Governor James Nyoro has ordered all bars and restaurants selling alcohol to close shop indefinitely starting next week. The order comes in the wake of public outcry of a breach of COVID-19 containment measures. The state still has no common ground on alcohol consumption.
I think I have done what the law has required me to do. Those are the things, conjecture.
15,000 shillings for drinking spree. Super Senator Johnson Sakaja is super happy after being fined just 15,000 shillings for breaching curfew rules by drinking with his friends past 9 p.m. The Nairobi Senator, who on Monday quit the chairmanship of Senate Ad Hoc Committee on COVID-19, says he does not regret the whole ordeal. We shall tell you why it's a country of 2 laws. Kalonzo quits NASA. Wiper Democratic Party has finally resolved to quit the NASA coalition. Kalonzo Musyoka's party wants to concentrate efforts on its new working relationship with the ruling Jubilee. The move is likely to stir political tensions, especially in Parliament, where NASA has been more alive. A very warm welcome tonight. Now, our sign language interpreter is Anne Wairimo, and we begin with COVID-19 matters. Kenya has started clinical trials for a drug that might just be the cure for coronavirus. 10 patients at Aga Khan University Hospital are set to undergo the trial that uses a drug called Actemra. This is as the number of COVID-19 cases in the country rises to 14,168 after 397 more people tested positive for the virus in the last 24 hours.
Kenya is one of 2 African countries that have started clinical trials for a drug that might just be the cure for coronavirus. According to credible sources, 10 patients admitted at the Aga Khan Hospital are set to undergo a 3-month time trial that will utilize the use of a drug called Actemra. Actemra is used to inhibit interleukin-6 receptors to prevent pneumonia that has been a characteristic of patients infected with COVID-19. This, as the Ministry of Health says, the progress made in the search for a vaccine in first world countries is huge and promising in the fight against coronavirus.
That's promising because if a vaccine has proceeded to that stage, it means it has passed these other tests. I heard that there is a vaccine in the US that's now entering phase 3. We know that there is a vaccine in the UK that is also progressing well. So the entire world is looking to a successful vaccine that comes out in good time and that will be able to protect people from getting COVID-19.
Dr. Rashid, however, says, much like in the testing of COVID-19, there are limitations in third world countries to adopt many of the manufactured vaccines due to limitations in resources.
Just like we told you about our testing, limitations with testing, the limitations of getting the equipment and getting the reagents because of the global supply chain and the demands. And the preferences, the more developed, richer worlds where these products are produced are the ones to benefit first, and we end up in the end of the queue.
The number of COVID-19 cases in the country rose to 14,168 after 397 more people tested positive for the virus in the last 24 hours.
Nairobi, 239 cases. Kiambu, 33. Machakos, 27. Nyeri, 17. Busia, 16. Nakuru, 12. Mombasa, 12. Kajiado, 10. Migori 8, Uasin Gishu 8, Kericho 5, Narok 3, Laikipia 3, Kisii, Kisumu, Lamu, and Nyandarua 1 each.
7 of the new COVID-19 survivors were on home-based care, whereas 55 were released from various hospitals across the country as 12 more people succumbed to the virus. For TV47, I'm Zainab Mohammed.
And away from that, more than 10 people have been critically injured following a stampede at the Likoni Channel this evening. The incident occurred when one of the gates at the waiting bay were opened, and as passengers rushed to board the ferry, scores were injured in a stampede. Now, most of the injured were women during the incident that happened on the island side. Now, in a statement, the Kenya Ferry Services Managing Director, Bakari Goa, however, did not speak about the incident, but said today at around 3:30 MV Kwale, while at mainland ramp, hit MV Safari gapping a hole on the side, which caused water ingress, flooding the engine room.
Kila siku huwa tunapita na upande huno, lakini leo tukapitishwa na huku. Sasa kuja kupita na huku tukapata wanaume ni wengi, wanawake ni wengi. Hapo kukawa kumefadhaika kabisa. Hatujui tuufanye nini. Hasa mimi Mwenyezi Mungu akanusuru. Nikashika ukuta hivi. Nikawaambia wenzangu wanne tusimameni hapa na tumswalie Mtume. Bila hivyo tutakufa sote. Basi inshallah Mwenyezi Mungu wale watu wakanisikiza. Tukasimama pale. Hatukupata madhara yoyote mpaka watu wote wakapungua. Kuja kupungua hivi ndio tunapata wenzetu wengi wamesambaratika chini, wameumia, wengine wametoka mapovu, wengine damu zinawatiririka. Nikaanza kuambia subra minallah. Tulieni hapa tulipo. Hivyo ndivyo ilivyokuwa, lakini kulikuwa na fujo sana.
Tulikuwa pale kwa kipanda. Sasa wale watu wakawa wengi, wakaanza wakati walikuwa wengi. Sasa wakawa wengi. Sasa wakati feri ilikuwa inakuja, watu wanaona nataka kubeba, ndio wakakuja kwa wengi. Sasa wakalaliana, sasa ile msukumano wakaanguka, hata mimi nikazungu nikaangia pande mbele. Nikaona giza hata sikuona nini.
Wewe umeumia wapi? Umeumia?
Mguu hapa nasikia kama mguu nimeumia.
Watu walikanyaga ama ilikuwaje?
Kanyagana.
Nilikuwa nimetoka kazini, nafika pale juu napata nimesimama vizuri. I was waiting for me to, nilikuwa nangoja nivuke hivi. Sasa penye nimesimama, badala wale watusaidie ndio wanatuumiza. One of the officers just beat me with that, no reason, slapped me. Ati nitoke mbele hapo, na mimi sina kosa yoyote. Sasa hizo nimebeba bagi yangu, kila kitu yangu. Badala aende atusaidie, ananipiga makofi. Amenipiga makofi for no reason.
And Kiambu Governor Dr. James Nyoro has issued an ultimatum to all bars, restaurants and clubs selling alcohol to shut immediately. The governor has said markets flouting COVID-19 containment measures will be closed too. Our reporter Mwangi Maina with the details.
Speaking at the Kiambu County COVID-19 Isolation Hospital in Tigoni, Kiambu Governor Dr. James Nyoro says eateries that were allowed to reopen have been turned into bars that operate even beyond curfew hours. Nyoro directing the establishments to close before coming Sunday.
And every bar today in Kiambu is operating as wines and spirit. We are saying tafadhali, funga hiyo wines and spirit. If you don't funga between now and Sunday, tutakuja Jumatatu, tutaifunga, revoke your license, and never again in the life of Kiambu County shall you receive a license to operate anything related to bar and restaurants.
Nyoro attributes the sharp rise in COVID-19 infections in his county to the don't care attitude and flouting of containment measures by Kiambu residents. The governor has threatened to close markets by Friday if they will be found violating containment measures.
The public health will be revisiting markets, and I want to announce that we shall be closing markets. We'll be closing markets that are not abiding to the regulations that we had said. That may hurt business. Now the thing is, before we come to close next week, we would probably appeal to people so that they can start to observe the things that we've been talking about. We want to enhance and make sure that water is available, that sanitizers are available, but also the distance and putting on masks.
The governor spoke at the groundbreaking ceremony in Tigoni Hospital, where another isolation center will be constructed in 2 months.
The structure you're going to groundbreak will give us an additional 100 beds, and therefore we'll see that in Tigoni we have 330 beds which will be ready by the end of that project.
We try to do what we can. Our focus is on education, health, environment, and of course also when in some cases where we do some emergency support, and very often we do that through the MRM Foundation, which supports us to execute on many of these things.
The facility will have a capacity of 104 beds and is being constructed in association with Mabati Rolling Mills.
Following the recklessness of Kenyans in adhering to measures put in place by the Ministry of Health to combat the spread of coronavirus, the government is forced to take punitive measures to ensure that these protocols are being observed. Mwangi Maina, TV47.
And medical personnel in Nyeri County are on high alert after 12 of their colleagues at a private hospital tested positive for COVID-19. Meanwhile, Kitui County records 2 cases of nurses who tested positive for COVID-19. Eli Logova with the details.
The increasing number of COVID-19 cases in the country continues to exert pressure on an already overwhelmed healthcare system. Nyeri County has the latest cases of healthcare workers with 12 testing positive, whereas Kitui County recorded 2 positive cases. The medics from the facility located at the heart of Nyeri town are currently in isolation.
47 in this county. Out of those 47, about 11 wamepona. Hao wengine tuko nao katika isolation centers zetu. Wengine ni madaktari. 12 of them ni madaktari. Wameambukizwa na wagonjwa wawili waliokuwa hapo. Kwa hivyo kuna tatizo na ni vizuri tujue.
Meanwhile, the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU has once again taken issue with the government's move to hire medics from Cuba despite the availability of locally trained doctors who are unemployed. The union now wants the government to hire 50 healthcare workers per county as one of the interventions in combating coronavirus. 20 Cuban doctors are already in the country after the government struck a deal to have them work for a period of at least 6 months.
We have seen 20 Cuban doctors who are said to be specialists being brought on board. The irony is that it has taken more than 4 months for the government to engage its own local doctors to combat COVID-19.
This comes as the country's disease burden continues to spike, surpassing the 14,000 mark and affecting the medical fraternity. One doctor, Doreen Lugaliki, and 2 other nurses have already succumbed to the illness, with more than 546 others infected in the country. Eli Logova, TV47, Nairobi.
Many thanks for staying with us on TV47 tonight. Let's take a short break, but I'll be back with more, and I'll also be speaking to Peterson Washira, who's the chairman of Kenya Union of Clinical Officers. We shall be talking about the handling of COVID-19 positive cases in the country and how well equipped our medical facilities are. Don't go away. Welcome back to TV47 News Tonight. Now, Nairobi Senator Johnson Sakaja has been fined 15,000 shillings after pleading guilty of breaking COVID-19 rules before an open court in Kasarani, Nairobi. Sakaja was accused of flouting the curfew rules after he was found drinking with friends at 1 a.m. 4 hours past the 9 p.m. to 4 a.m. curfew imposed by the government to curb the spread of COVID-19 in the country.
It was an unprecedented moment when Nairobi Senator John Sakaja appeared before Chief Magistrate Roslyn Oganyo. The self-acclaimed Super Senator was ordered to pay just 15,000 shillings fine after being found guilty of breaching the night curfew. He was found drinking alcohol at a restaurant at 1 a.m. on Saturday. The blatant violation of the set regulations by the Senator mirrors double standards by the politicians who are setting the standard too high in the name of stopping the spread of COVID-19. By the time of his arrest, the youthful politician was the chair of the Senate and HOC committee in charge of the fight against COVID-19.
The maximum sentence for the offense committed apparently is only Kenya shillings 20,000 or in default 6 months in prison. Being a first offender and in line with the sentencing policies in place, I will consider fining the Honorable Senator to pay a fine of 15,000 shillings, or in default he shall serve 3 months in prison.
The state prosecutor argued that the court should consider a harsh penalty against the senator in order to send a message to political leaders that the rules were not made for all the common citizens but are meant for all to obey at all times. However, the ruling has triggered questions over alleged selective application of the law. Many believe the fine was too lenient and the populace who look up to him could follow suit and be reckless in keeping the night curfew order.
Said that yesterday I had written to the Speaker about that committee, and I meant it. And I mean, it's something that will be seen, it's visible, it will be there on the floor of the House today. And we move on and we do what we're elected to do.
Critics cite the application of double standards in the enforcement of COVID-19 prevention regulations when it comes to politicians. In several instances, politicians have been seen holding political gatherings in full disregard of COVID-19 protocol and even under police protection. The same cannot be said about the common mwananchi. In one instance, a man was beaten by police to death after breaching the curfew to rush a pregnant woman in hospital on a motorbike. Hundreds others have been forced to quarantine facilities even without testing for COVID-19. For Sakaja and his ilk, a slap on the wrist is enough warning. At least he has learned his lesson after paying 15,000 shillings for it. The senator must have struggled to raise the near maximum fine for the offense. Well, it's a country of two laws. For TV47, I'm Nancy Kimuyu.
And in politics, the Wiper Party has resolved to hasten coalition talks with the ruling Jubilee Party. The party says the NASA coalition is dysfunctional.
The National Executive Council of the Wiper Democratic Movement resolved to move with speed to move into a coalition agreement with the ruling Jubilee Party amid the emerging political realignments in the country. Wiper says the NASA coalition is no longer functional.
Even if we were to accept that legally we have the NASA coalition, which is registered with the Register of Political Parties, but clearly NASA has become dysfunctional.
The party is expected to convene a special National Delegates Conference soon to approve the NEC determination concerning the foreseen merger.
We cannot conclude a coalition agreement without calling for a delegates conference. And it will really spark, in my view, the correct political realignment to which I made reference during the last NEC meeting.
Meanwhile, the party is expected to approve the report of the Wiper Disciplinary Committee that recommended the kicking out of former Machakos County Senator Johnson Muthama from the party. The party says it will write to the Registrar of Political Parties concerning the decision.
We get the report and hear what they recommended, and that report itself, I think, is a matter of now communicating with the registrar of political parties expeditiously, and then deleting the name of a member from our register.
Nanok Lauren, TV47.
And Sports Cabinet Secretary Amina Mohammed, Kenya's candidate to the World Trade Organization's top post, said she's seeking Washington's backing and expressed some sympathy with its criticism of the global body as she emerges as one of the two reform-minded African female front-runners. Amina Mohammed said a closed-door vetting session last week went really well as she outlined her platform to steer the body out of crisis from global trade tensions and rising protectionism to a COVID-induced dive in business.
It's a quest that Sports CS Amina Mohammed is determined to fulfill. Delegates say Mohammed, a 50-year-old minister and former WTO chair, is one of the favorites alongside Nigeria's Ngozi Okonjo to replace Brazil's Roberto Azevedo as Director General, although weeks of campaigning lie ahead. The WTO has never been led by a woman or an African.
I think for me, getting the AB back on its feet would be a priority, because we need, a multilateral system that everybody has confidence in and that everybody would like to use. We've used it before. All the, the big players have used it before very successfully. So we need to go back to that space.
The United States has paralyzed the appellate body by blocking new judges. In an apparent nod to Washington, she referred to the concerns about the body's overreach.
I think those the concerns that have been raised, they would not have been raised if they did not have solid reason to raise them, and they should be. And there's, I think, evidence that has been provided, and I think it's important that we address that.
The U.S. mission did not immediately respond to a request for a comment. Her supporters, including her current boss, President Uhuru Kenyatta, say she combines deep WTO knowledge with a drive to overhaul its 25-year-old rules. However, she must win over those African countries who have expressed support for Okonjo-Iweala.
So the difference, I think, between me and them is that I have worked this system. I have worked it fully, and not just as a delegate, but as a chair of the different bodies. I have delivered as an ambassador in Geneva. I delivered an amendment to a major, treaty, and I delivered a decent package in Nairobi. I don't think any of them can claim that. They can't claim that, and that's why I believe that I can hit the ground running.
Over the past week, countries have been hosting Geneva cocktail parties to showcase candidates. The WTO eliminates them in batches, starting with those unlikely to win consensus from 164 members. For TV47, my name is Tracy Mokami.
And Tanga allied member of parliament from Bungoma County have cast doubt on the government's waiver of more than 62 billion shillings in Nzoia Sugar Company debt. Now, the national government has waived the debt in a bid to revive the debt-ridden Ken Miller. Our reporter Mike Kagwongo has the details.
Led by Kimilili MP Didmas Baraza, the MPs have dared Agriculture CS Peter Munya to disclose to farmers the documents indicating the waiver, alleging that they had earlier been duped by CS Aden Mohammed, who promised to waive the debts but didn't.
Mheshimiwa Waziri, mimi ni mjumbe ambaye nimechaguliwa kwa chama ya Jubilee. Wakati tulikuwa tunamtafutia Rais Uhuru Kenyatta kura, Rais alitupatia waziri ambaye alikuwa ameketi kwa kiti ambayo umeketi hii, anaitwa Aden Mohammed. Tulikuja na yeye hapa Nzoia hapa. Ingawa mkutano tuliharakisha, tulikuwa tuliambiwa Mheshimiwa Mnyinyi alikuwa anataka kuja kutufuruka, tukaharakisha ile mkutano. Na yeye waziri ambaye alikuwa wa serikali alituambia madeni ya Nzoia ilikuwa imefutwa na kumbe bado ilikuwa haijafutwa. Kwa hiyo wewe utueleze certificate isikuwe ni story kama ile ya waziri Aden ambaye alikuja hapa na kuondoka pale.
And I want to say this,
humbly that if it is true, then the collaterals that Zoya has put in the banks must be retrieved. That is the only way you can tell us that you have written off the debts of Zoya.
Baraza wants CS Munya to address the welfare of sugarcane farmers, stating the various leaders at the Nzoia Sugar Factory have been making unfulfilled promises to farmers.
Swali ambayo mimi nauliza hapa, haya madeni ambayo yameaccumulate, ikiwemo ukosefu wa kulipa mkulima, miwa ambayo walinunua wakatengeneza sukari, wakauza sukari, hiyo pesa ilikwenda wapi? MD ambaye amekuja hapa, mgeni huyu namshukuru sana, amejaribu kusaidia. Kwa hivyo Bwana Munya, kabla uondoke hapa, huyu chairman ni wa zamani zaidi, atakuelezea wale wakora waliopora mali ya umma hapa, ukiondoka hapa wewe na wao. I myself and Mheshimiwa Wanga, who was the vice chair of agriculture, we tried to push and see if you can put some funds in your budget because of Zoya. That did not happen. And therefore, I become amazed when I hear that the debts of Zoya have been written off, and yet the process has not been followed.
Meanwhile, Kakamega Governor Wycliffe Oparanya says that governors from sugarcane growing counties in the country will hold a meeting on Wednesday this week to deliberate on the dues owed by sugar millers to the government.
Na hiyo madeni kutolewa ni ukweli, kwa sababu tukifika hapa jamani, trust us as your leaders. This Wednesday, all governors from sugar growing areas, we are meeting in Kakamega to discuss hii wiki ya leasing. Hatuwezi kuwa viongozi wa watu na mambo imefanywa mabaya na sisi tuko hapo tunaangalia.
Reporting for TV47, Mike Kagwanga.
Now, at least 20 kids aged between 10 and 15 years have been arrested watching and recording pornography in Maraba's village in Kakamega. The kids were arrested in an abandoned house in the outskirts of Kakamega town. They were detained by the police for counseling. Area residents are now calling for the arrest of the owner of the abandoned house, claiming this is not the first time the kids have been involved in such cases. And we shall have that story later on, a world we're living in. Now, High Court Judge Weldon Korir has temporarily ordered the Kirinyaga County Assembly Speaker not to authorize any withdrawal of monies from the County Revenue Fund. Meanwhile, the Senate Devolution Committee has started the mediation to resolve Kirinyaga County wrangles. The committee met Governor Waiguru today and is set to meet the MCAs tomorrow. Our reporter Joash Onsare with the details.
Kirinyaga Governor Anne Waiguru appearing before the Senate Committee on Devolution under the leadership of Moses Kajwang via Zoom together with the Office of the Control of Budget has said there is a dire need to resolve the standoff in the county for better service delivery.
We have critical services to provide such as healthcare. We have no oxygen. We have no medicine in hospitals right now. We don't have any supplies, and we need also to pay salaries. So it's very critical that this matter is resolved soonest possible.
The Control of Budget, Dr. Margaret Nyakango, in her contribution said the County Assembly of Kirinyaga failed to comply with issues highlighted by her office.
When we did our analysis, and that was way before these things started happening, we highlighted certain issues which we communicated to the county. And apparently, the same issues were then picked by the assembly, but I dare say they were then misused to make certain changes.
After the High Court temporarily ordering the County Assembly not to authorize withdrawal of monies from the County Revenue Fund, Dr. Nyakango said it will be complicated for the county to get 50% of its expenditure budget to continue giving service to the citizens.
However, with an injunction in place, Chairman, I wish to inform you that the matter gets a little complicated because the only way the county will get the vote on account is through a court order.
To resolve the county standoff, the Senate Committee on Devolution will meet Kirinyaga County Assembly representative on Wednesday. Joash Onsare, TV47, Nairobi.
A teacher and his 2 children have drowned in River Sagana while they were trying to cross the river. Now, the 3 were headed to their farm in the Gadi village, which is on the other side of the river, before their demise. Now, the accident happened after their boat capsized in the river.
Nilisikia duru, nikateremka, kufika nikapata ni watu wamebebwa. Mwenye mfanyakazi wao ndo akasema ni huyo baba na watoto wake.
Mwalimu wa shule inaitwa Karemaini Secondary School akabebwa na maji, na ile kitu ningetaka kuwaomba wale watu wanatumia hii mto mtu anaweza ona kama imetulia hivyo, lakini nakuaga imebeba maji mingi sana.
Thank you for staying with us on TV47 tonight. We'll be taking a short break, but when we come back, I'll be speaking to Peterson Wachira, who's the chairman of Kenya Union of Clinical Officers. We'll be talking about the handling of COVID-19 patients in the hospital and the preparedness of our medical facilities. welcome back to TV47 News Tonight. Now let's get to our discussion. And joining me now is Peterson Wachira. As I said before, he's the chairman of Kenya Union of Clinical Officers, and he was actually one of the few volunteers who handled the Ebola pandemic in Western Africa. Thank you so much for joining me, Peterson, tonight. And we're going to be talking about the handling of the pandemic in the country, the preparedness of medical facilities. First, Peterson, would want to get an understanding of the challenges being faced right now. Were the challenges that you faced in the Ebola pandemic any different or similar to what's being seen with the COVID-19 pandemic?
Thanks a lot, and thanks for having me. Let me say that when it comes to outbreak management, you'll always have some challenges because you can never be very well prepared to handle any outbreak. It's a level of preparedness that is expected, and especially when it comes to a time when the outbreak started elsewhere, and by the time it was coming to you, then you are supposed to have put some measures in place. So the challenges that we saw with Ebola in West Africa, we are seeing many of them here, especially when it comes to issues like maybe things not being done timely as they should be when it comes to matters pertaining training, pertaining welfare of the health workers who are actually the last line of defense, meaning that if then they are overwhelmed, then you have nowhere to run to. And even when it comes to their protection, as they deliver services in the context of a very infectious disease with quite a high attack rate. And also when it comes to funding, because you understand that such an infectious disease requires very high quality protective equipment that will cost a lot of money. And of course it comes with other unintended effects where you have to even give some vulnerable households some money to be able to sustain themselves. So there is also that aspect of funding that will also never be adequate to cover for the needs, right. As it may be. Yeah.
All right. Peterson, as you continue explaining that, there's also the dilemma of if a patient is exhibiting any of the symptoms, where should they go first? There's been that confusion, the laboratory or the hospital. Where should they go first?
No, they should actually not go anywhere. What they should do is that they should call the number provided so that we can come to them and pick them and go and test them. Because when you present yourself, and especially if you do not have your own means, then it means you might be exposing everybody that you'll be coming into contact with. And that is on your way to the bus stop, then through the commuter transport, and then in the hospital, in the waiting bay as you wait maybe to see a clinician who will be able now to make this diagnosis or as per the case definition and define you as a suspect, and then they can be able to test. So what we are saying is, please don't come. Call us. We will come for you.
I would like for you to clarify is the issue of the procedure standard in terms of the first person a patient meets when they're taken to the hospital is the guard. And they're screened, then they're taken to the reception and on to see a nurse or a doctor. So let's talk about are all the medics, is everybody in the hospital handling the patients supposed to have PPE kits? What kind of PPE kits? Right from the guard to the receptionist? Talking of PPEs, there has been a shortage and there has been talk of shortage of PPEs in the country. So how should that be handled? Now seeing that the guard is handling the patient, they are handled by the reception. That's where most of the talking goes on.
Okay, thank you. There are different types of PPE for different areas. And this is determined by the level of exposure, depending on the area you are. Then we are going to do an occupational health audit to show the risk. And then with the risk category, we can now be able to allocate certain PPE for certain areas. So at the gate, for the watchman, probably the only thing they may require is a surgical mask, and probably they can have some gloves. Then as you come in, as you meet now the receptionist, they should actually have the same, but there must be that distance. And of course, when you go to the nurse, as she triages you, now at that area, which actually should be in open air, they should also have their surgical mask and of course their gloves. And now when, from the nurse, from the triage point, they will be able to define you as per the case definition. If you are a suspect, then you should not actually proceed and see a clinician. They should be informed first so that they can be able to properly don or wear a full PPE, and then they will be able to handle you and to direct you to a holding area if that facility does not actually have isolation facilities so that you can be picked. And if they have isolation facilities in the area, they can be able to call whoever is in the isolation facility so that they can be able to pick the person up. They are tested as they are quarantined, awaiting for the results, and then of course they will be isolated.
Thank you, Peterson. We'll be back with more. I'll be talking to Peterson Wachira, who is the chairman of Kenya Union of Clinical Officers in the country, one of the few people who handled the Ebola pandemic in Western Africa. Let's take a short break. We'll be back with more. Welcome back to TV47 News Tonight, and joining me once again is the chairman of Kenya Union of Clinical Officers, Peterson Wachira, one of the few volunteers who handled the Ebola pandemic. We're talking about handling of COVID-19 cases in the hospitals and the preparedness of our facilities. Thank you once again, Peterson. Let's talk a bit about the safety of our health workers. It's been said that there are a lot of risk factors when it comes to putting on and taking off the equipment, the PPEs, the masks, what are some of the risks involved, maybe?
Okay, thank you. And maybe as I talk about the risk involved, let me first say that may those of us, my colleagues who have succumbed to COVID-19, rest in peace. And I think this underpins the risk that the health workers are working under, as even they try and help the country to manage this outbreak. So in the PPEs are part of a larger infection prevention and control measures put in place, and they are meant to protect you so that you do not get the contact and aerosol, the particles, and even from contact, that is the droplets that can actually be able to infect you. So usually, you have a procedure for putting on the PPE that we usually call the donning. And then when you are removing, you'll have a procedure we call the doffing. Now, while in that PPE, the temperatures can actually rise to as high as 40 degrees. And this is why you have heard us calling from the start of this pandemic, saying that there is need to ensure that we train 100% of health workers by the time we are actually getting community spread. But now we are in the community spread. I understand it's around 15% only of the health workers that have been able to be trained on this, and this is actually one of the reasons as to why we are getting infections with the health workers. So it is very, very important that at the onset of the outbreak, as a priority, you do training on infection prevention and control with a focus of personal protective equipment, so that you ensure that the health workers you're having are confident enough in themselves as far as handling of the patients inside the personal protective equipment is concerned.
Peterson, the other issue is we've heard of a lot of people who are succumbing to COVID-19 are people who have underlying conditions, diabetes. We've had people with malaria, pneumonia. So how should our health facilities go about testing, these other underlying conditions, for instance, pneumonia or malaria? How should our medical facilities go about this, not just testing for COVID-19?
Okay, that's a very good question. And let me start by saying that there is a group that we call vulnerable. And that means that they are at a greater risk of getting severe disease, critical disease, and even dying from COVID-19. And these are people with pre-existing diseases and conditions, and some of them, like diabetes, being on top. But I would like to tell Kenyans that one of the conditions that people never think about is obesity, having excessive weight. And we have actually seen from some statistics in South Africa that actually people with obesity, with or without underlying diseases or conditions, are actually dying at a higher rate than even people with diabetes mellitus. So what there is that even in the midst of COVID-19, the other essential services have to continue. And even as we test, maybe what comes out is that we only give a COVID test. But actually when you come to hospital, you don't just do a COVID test. We do all the tests. But because of the pandemic we are in now, that is why it is more pronounced, because if you have your diabetes but you don't have COVID-19, then we know that you do not have a greater risk of actually getting, worsening your diabetes and probably dying from it. But that one with a diabetes and then they have COVID-19, of course it becomes a great concern, because these are part of the people that we are actually losing from this disease. But I think on that, what I would like to tell Kenyans again is that we have seen cases of people without even underlying conditions and diseases who have actually succumbed from COVID-19, some of them in their youthful age, under 35 years old. So the talk of that somebody is young and they do not have other diseases, that they can actually not succumb from this disease, is no longer there.
Because we're talking about medics identifying patients who exhibit symptoms, I mean, I would like you to talk about our preparedness in terms of how prepared our nurses, our medic, in terms of, identifying COVID positive patients who exhibit these symptoms, in line with the WHO recommendations for identification of COVID-19 positive patients.
Okay, thank you. So once a patient will come to the hospital, or they have called the 719 number, then a series of questions will be administered to them through phone if you call. But if you come to a hospital, then the nurse or the clinic officer will be able to see you, will be able to use what we call a case definition. A case definition simply tells a health worker or helps a health worker to be able to differentiate between somebody who is a suspect, and suspect means you are meeting a certain criteria that means that you are more probable to have that disease or not. And so once they are able to use the case definition and they can see, and the case definition, by the way, is keeping on changing. At first, the classic symptoms were that you are going to have a cough, maybe fatigue, and also congestion, then progressing to maybe difficulties in breathing, and then all the way to the critical disease. But we are now seeing that a good number of people are actually presenting with diarrhea and vomiting, something that most of us could not actually think before that would make a suspect for such a disease. And we have also seen that it's actually attacking so many areas, like some people are actually presenting with type 1 diabetes for the first time, because it has been shown that actually coronavirus, to some people, it's causing type 1 diabetes. And so as you think you are diagnosing somebody with diabetes, actually the real cause is COVID-19. So there is a case definition that has been provided by WHO, but it keeps on being updated because this is a new disease that we are learning as the days go by. And so as we see new features, then we are able to revise the case definition, and then that is what we are going to use as medics to be able to put a criteria, and then we can say you are a suspect, and then we are going to test you and to isolate you where need be.
All right, Peterson, thank you for that. And as we're winding up, would want to know, the government and the Ministry of Health has been heavily criticized for bringing in doctors from Cuba. We've had a section of our medics criticizing that, saying that there are a lot of jobless medics who are properly trained. So according to you, Peterson, is the government justified to bring in these doctors from Cuba? And then going back to my question, how well are we prepared as a country to deal with this? How well prepared are our medics? Can they really handle this?
Thanks a lot. And let me say this, that sometimes we as health workers, we feel like our government treats us with contempt, and because of certain issues. As you have said, you have rightly put it, we have so many health workers who remain unemployed and who are competent, from nurses, laboratory technicians, ourselves, the clinical officers, and even the doctors. Right now, we are actually having a dire shortage, and I can assure you, 20 Cuban doctors who actually will spend an amount that would be equivalent to employing maybe 100 Kenyan doctors, or employing up to 500 or 1,000 clinical officers, actually does not help us. And what we have been able to see is that in many aspects, number one is that I think before we reopen, we actually did a letter to the Ministry of Health, to the Council of Governors, and we gave them a reopening strategy. And this is what we told them, that at this time we are having community spread, and we are saying we have a vulnerable group. There are things that you can be able to do so that we will not actually require the ventilators that you're actually purchasing and the ICU beds. And that is, please employ an extra 10,000 health workers so that we can do what we call reverse isolation. Instead of isolating now the sick, looking for the sick and isolating them, you isolate the vulnerable in the population. Anybody with a pre-existing disease, anybody beyond maybe 58 years, tell them to stay at home. And because they are having conditions, use the 10,000 health workers, that is clinical officers, nurses, doctors, all of them. Then use them to go to their own homes so that they do not have to live there. Because when they leave and go to hospital, you are actually exposing them. And we are saying they are vulnerable. Let them stay at home, employ more so that we can be able to go and see. We do home-based care. Now we are doing home-based care, home-based isolation for those who are sick with COVID. But we are saying we can also do home-based care as an essential service for the vulnerable so that they do not have to venture outside, and that is where they are going to be infected. and then you now utilize your ICUs, and probably you'll have to bury so many people. So after we say this, and then they do not say a thing about it, they do not adhere to what we told them, and then we see them bringing in some foreign doctors, then I think for us, we feel that we are being held in contempt by our own government.
Thank you, Peterson. And you just coughed right there, so I don't know if you need to go get checked, but thank you for joining us tonight. And,
I'm okay.
Yes, thank you so much for explaining some of the things that our medics need to do better. Our health facility needs to do much better. Thank you so much for joining us tonight. That's all the time we had on TV47 News tonight. Our sign language interpreter has been Anne Wairimo. My name is Mombi Chege, sitting in for Abubakar Abdullahi. Have a good night. I'll leave you with the weather forecast. Good night.